We are getting a first look at how much immunity Canadians have developed to COVID-19. Turns out not too much. Canada's Immunity Task Force has released preliminary results of the 10,000 blood samples they analyzed. Less than 1% had antibodies present, which means finding a vaccine remains a huge priority. Oxford University appears to be leading that global race after showing some promising results earlier this week. For more on both of those fronts, we've reached Dr. David Naylor, the co-chair of the Immunity Task Force, as well as Dr. Kwang. He's the director of the Centre for Vaccine Preventable Diseases at the University of Toronto. They're both in Toronto. Hi to both of you. It's wonderful to welcome you to the program. Welcome you back, Dr. Naylor, I should say, and it's wonderful to meet you, Dr. Kwang.
Delighted to be here, Vashi. Thank you.
Dr. Naylor, let me start with you and on those results of the serology test, the antibody test. We kind of summed it up in the intro, but tell me a bit from your read what those results indicate about how we might have to tackle this virus going forward.
I think the picture is pretty clear, Vashi. We've got to be proud as a set of communities that have really done our bit to try to contain community spread. It's very good news in that sense. It's reassuring to Canadians. On the other hand, the reality is that in terms of background immunity, there just isn't much. And we've looked at these data and thought about potential sources of error. There's certainly with blood donors a selection bias. You may get a healthier population with lower levels. We've looked at the test performance and thought about that, which might actually push it the other way. No matter how you cut it, this is going to be a small number. We'll look at the other 27,000, 28,000 in this set over the next few weeks, try to get a read on some of the regions and cities. But right now, the message is clear from 9 provinces. We just are looking at a lot of susceptibility from coast to coast to coast. So a vaccine is an imperative, good treatments are an imperative. And unfortunately, although we all want to get things going, we want the economy to start, schools to start, all that makes sense, but we have to be careful how we do it. We've got to be prudent.
Before I move on to Dr. Quang, I just quickly wanted to follow up with you and ask a bit about the process by which you mentioned some thousands of other tests that are going to be analyzed. I remember the initial plan, I think, was over a few years, 1 million tests. Do you anticipate, as more tests come in or are conducted, that those results will change very much? Or do you think this sample is pretty representative of what you'll see?
I think despite the limits of a selected group of blood donors as a volunteer group, often health conscious and socially conscious, this is going to be pretty much the pattern we see. We're waiting for Quebec. We have a partnership with Quebec and expect them to come through in the next week or so. That may be higher because the epidemic has been a tough one in the Belle Province, but in general, I'd be surprised if a lot of the provinces varied. I believe that we should hear more from Ontario and Alberta in the days ahead. They've also been doing this type of opportunistic or convenient sampling. So let's see where the numbers go, Vashi, but my instinct is coast to coast to coast, we're going to see pretty low numbers and a bit of work ahead and a lot of reliance on the vaccine wizards.
Dr. Quang, speaking of the vaccine wizards, can you tell us from your perspective how significant a vaccine is going to be, given what we just heard from Dr. Naylor about the results of the serology test?
Yeah, it's obviously going to be critical. A vaccine is probably our way out of this, assuming we can find a safe and effective vaccine that we can deliver, to as many people as possible, as quickly as possible. So, until then, we're going to have to rely on the public health measures, but hopefully we'll have a vaccine within the next, year or 2 years to distribute to the population.
How likely, based on what you've seen so far, Dr. Quang, and I'm thinking of, I'm sure you're much more versed in all of the pursuits that are out there right now, but we saw the headlines around Oxford, for example, this week. What are your impressions based on what you know about the likelihood of a vaccine actually successfully being developed?
Well, there's over 150 vaccines that are being developed right now worldwide. So that's good news. There's like so much concerted effort to develop a safe and effective vaccine. And these trial results that were released this week are promising. This shows that they induced antibodies in the individuals who received this vaccine, as well as the T cell response. So both of these components of our immune system should help to protect us against this virus. However, what we don't know yet is if this vaccine actually does prevent the actual infection. So that's what's going to happen in the next phase, the next trials that are happening right now, actually. So they're studying, the current trial was only 1,000 people. The next trials are going to be, 40,000 people, and they're going to look to see if it actually prevented infection and if it's safe in the larger population.
Dr. Naylor, I was just listening to Dr. Dina Hinshaw in Alberta, who was saying even if there is a vaccine, it's not necessarily going to be immediately available to every single Albertan. Can you talk a bit about what it will take to make it available to all Canadians and that scaling up issue and how much of an issue it could be?
Thanks, Vashi. It's a massive challenge. It may be one of the biggest national projects this country has taken on in its history, if you think about it. The goal has got to be to deliver this vaccine to countless millions of Canadians. We've got to figure out how to acquire it. So I know Procurement Canada is on it, Health Canada is on it, the Innovation, Science and Economic Development Ministry. All these ministries are working to build bridges to manufacturers, to think about Canadian manufacturing capacity, to try to make sure that we can get vaccines to test in Canada to get a leg up on other countries. All that is happening. But when we start to get these vaccines, we'll have to roll them out, test them, assess them in the field for real-world safety, try to figure out if one is better than another in a sort of comparative basis as we roll them out. But most importantly, Vashi, this is not going to be just logistics. It's going to be a political and ethical issue on some levels. Who goes first? Is it healthcare workers and long-term care workers? Is it retail workers? Prisons and homeless shelters are areas where COVID can burn through. Our remote Indigenous communities are very, very vulnerable. So Canada's going to have some hard choices to make, as well as a lot of hard work to do to get this scaled up and delivered in a safe, effective, and ethical way. So a huge national challenge.
Okay, I unfortunately have to leave it there. I'm out of time, but I thank you both very much for your time this evening. Wonderful to have you on the program.
A pleasure. All the best. Thank you.
Thank you. Thanks to Dr. Jeff Quang as well as Dr. David Naylor. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.